Hi, my name is Micah Smith, and this is a report presentation on the future of robotic-assisted stroke therapy. Stroke is in the top 10 leading causes of death for Americans, and for people over the age of 65, it's in the top 5. Researchers are exploring every opportunity to help stroke victims in their plight. In the late 1990s, MIT developed a robotic system, and they conducted research experiments to see its effectiveness on the ability and recovery of stroke patients. 96 patients were part of the research, and they were divided into an experimental group and a control group. The experimental group was given regular physical therapy with a human therapist, and then several times a week they were given robotic therapy. Looking up at a display, the patient would try and manipulate the robotic arm of the device. They would follow instructions on the screen, and if unable to perform the task, the robotic system would help them. Patients in the control group were also given physical therapy with a human therapist, and they were also given therapy with the robotic system. However, unknown to them, the robotic system was shut off, and if they could not perform the task, it would not help them finish it. This served as a placebo for the control group. The experimental group showed a conclusive improvement over the control group in all areas of muscle function. Not only that, but the brain lesion size of the experimental group also improved. And it was shown that the improvements lasted as long as 3 years after the experiment. Robotically assisted neurotherapy for stroke victims is a viable option for the future of stroke recovery. Results are conclusive enough to warrant moving forward with the technology in rehabilitation hospitals nationwide. Despite continued education and advances in prevention via drugs and other methods, stroke continues to be the leading cause of disability today. The good news is that the overall mortality from an acute stroke has fallen. This is due to advances in medical treatments for stroke patients and revised treatment protocols from in the past. The problem is the high percentage of patients, 9 out of 10, still have significant neurological issues that require long-term treatment. This is a typical setup for stroke patients during therapy. The patient's torso is fastened to the chair. The arm is positioned to manipulate the robot according to the data displayed on the screen. Therapy lasted for 45 minutes each day and took place 5 days per week for 4 weeks. During therapy sessions, patients performed 1,024 exercise movements with the area of their bodies affected most by the stroke. As this figure shows, these movements were split evenly into flexion and extension exercises. They were also split evenly into 8 different directions, represented by the points of a compass. Even though the scope of the experiment was quite small and the patient size was limited, we believe that the significant increase in ability that the patients showed garner far more research into robotic-assisted therapy. Our group recommends a much broader implementation of this technology in the future. As the ability of computer systems vastly improves, so will the ability of computer systems vastly improves, so will their ability to treat As the ability of future computer systems vastly improves, so will their ability to help us in our goal for better health.